I have given a similar presentation at one of the Phelan-McDermid syndrome conferences, but I wanted to make sure that everybody feels free to ask any questions along the way, and I also wanted to include some new questions that might have come up that I've been answering along the way. So first of all, about me, as Jackie said, I am a physical therapist, a certified lymphedema therapist. I've been a physical therapist since 1997 and a lymphedema therapist since 2003. The Lymphedema Association of North America certification is renewable, and mine is next due to renew in 2019. My husband, Christopher, I married in 97, and my son, Jonathan, was born in 2003, and my daughter, Tori, in 2005. So you may recognize this. So what is lymphedema? That is the big question. Lymphedema is a permanent condition that develops when fluid collects in tissues and results in chronic swelling or edema. It most often occurs as a result of trauma to the lymphatic system from injury or surgery, but it can also come from a poorly developed lymph or venous system that results in lymphedema. So lymphedema is fluid in the tissues that's sitting there and collecting, and it's happening over a long period of time. It's chronic. And the reason it's there is because the lymph system is not working properly. So who gets lymphedema? Who gets that swelling in their tissues? People with damage or improper function to their lymph system get lymphedema. If you have damage, you can get it, but not everybody that has a damaged lymphedema system gets it. When you have damage, you are called at risk. So you can have damage either from birth, which is what we believe is going on in those in Phelan-McDermid syndrome, which means that it's congenital or primary lymphedema, or from damage to the lymph system at some other stage of life. And some types of damage include lymph node removal, trauma, surgery, and those are all called secondary lymphedema. You only have lymphedema when you start to swell. Before that, you just have a damaged system. When your body can no longer remove the fluid that is being transported to that part of the body, that is when that particular part of the body gets lymphedema. So we call it a fluid balance problem. Our heart is pumping blood and fluid and through the arteries to all the tissues in the whole body. Every single cell needs nutrition, needs blood to help make the tissue live and survive. Once we get the tissue and the fluid there, we need to get the fluid back out again. So we use our venous system, our veins, and we use our lymphatic system. Our lymphatic system transports mostly the bigger molecules like the proteins, and our venous system is mostly water. But when you get more fluid coming in than coming out, then you start to notice a swelling. So lymphedema is caused by an abnormality of the lymph system causing fluid to collect. The stagnant lymph fluid is full of protein and cellular debris, and lymph is part of the transport. The overall risk of lymphedema does not diminish. So that's the interesting thing is that once you're at risk, we don't fix the lymph system at this stage. We're hoping to in the future, but right now we're more working with making the system work more efficiently, but we don't put in new lymph nodes. We don't make the lymph vessels work more efficiently or fix them mechanically. We are just working with what's there and trying to make the lymphatic system work better. So progressive lymphedema has complications. By progressive lymphedema, I mean lymphedema that goes untreated. So if there's more fluid coming in than going out and you're doing nothing to help the fluid to leave, over time that fluid's going to start sitting there longer and slowly start accumulating more and more. And when the fluid sits there longer, it has some materials that are some debris that's just sitting there that might have bacteria in it. It also has nothing to help with the fluidity, so it starts to get harder, and some other complications can arise if we just ignore the lymphedema. So primary lymphedema means that you have damage to your lymph system at birth. It does not mean you have swelling at birth. It just means that your lymph system isn't functioning as well as it should. And that, even though we might not be able to see that, that is from birth on. That can be because the vessels are too large so that the fluid is slipping past the valves. It can be that the vessels are too small, so we're not getting rid of enough fluid. There can be the wrong number of vessels. The vessels can be going to the wrong locations, so the fluids aren't being filtered out. And we're not really sure what's going on in Phelan-McDermid syndrome. We're not sure if we know what the cause of the swelling is at this point in time. So what we use our lymphatic system for, we use our lymphatic system, our healthy lymphatic system, to remove proteins from the tissue. We use it to remove fluid. Again, it's removing about 10 to 20% of the water that's brought into the tissue, and then mostly the bigger molecules. And third, we use it to identify substances that don't belong and attach and destroy them. So that's our part of our immune system in fighting infection. So sometimes if the lymphatic system isn't working as efficiently, we do have a little bit more difficulty getting rid of bacteria and infections in that part that is affected. It doesn't mean the whole body, but the part where the lymphatic system isn't working. So the lymphatic system is a system throughout the body. It kind of mirrors and goes along wherever the arteries, veins, nerves go. There's a lymphatic system paralleling along. The lymph fluid circulates in the tissue and the interstitial spaces. So in between the little cells that are in your body, there's fluid that's normal and healthy, but also the lymph fluid can start to accumulate there. 90% is reabsorbed by the blood in the tissue, and 10% is left behind. And that's in a healthy system. The lymphatic system drains excess fluid and protein, and it is a different transport system than the blood. It's not part of the blood and veins, but it does work with those systems. The fluid that is not draining is the lymphedema. So where does lymphedema occur? The lymphatic system works a little bit uniquely. It kind of has some major areas where it works and functions kind of like drains. So if you look at the picture on this slide, above the collarbones is the head and neck region, and that has a whole bunch of lymph nodes, and they generally drain the head and neck. In each, from the belly button to the collarbones is the upper half of the body, and the belly button downwards is the lower half of the body, and then we divide that in half through the spine and the sternum or the breastbone. And your arm, and from your breastbone on to your arm and around your back, that one quadrant is mostly drained into your armpit. And so the right side drains into the right armpit, and the left side drains into the left armpit. And then in the lower part of the body, from the belly button down, the groin and the leg, they all drain into the lymph nodes around the groin region of the leg. And that happens on both the right side and the left side. So there's basically the 4 quadrants plus the head and neck are your main drains. That does not mean that other parts of the body cannot help each other. There are connections, but normally the body wants to drain to those regions. And that's why you often see just one arm or one part of the body that is having a problem. And sometimes people that do have it, say in either both arms or both legs, they'll notice one leg is much more than the other leg. And that's because they work as separate systems. And then the rest of the body tries to help out. So lymphedema is classified in stages. The latency stage means that, and maybe unbeknownst to you, means that the body has something wrong with the lymphatic system, but there's no signs of swelling. Stage 1 is called spontaneously reversible, and what normally is seen in this stage is that you have periods of swelling and puffiness, and then they go away. And that can just be during times of stress, the body, or when the body's working really hard, it swells, and then when it has a time to rest and catch up, or with a little bit of help, the swelling returns back to normal, and you can't tell that there's any swelling there. Stage 2 is spontaneously irreversible, and that means that there's still a fluctuation, there's still some softness to the fluid, but the fluid is, even with a lot of help, it doesn't seem to go 100% away. There's always something there. And stage 3 is called lymphostatic elephantiasis. And stage 3 is generally fluid that's been accumulating over a long period of time, and often it hasn't gone through some assistance with treatment or with therapy, and so the tissue is starting to change. The skin will sometimes get harder, sometimes there'll be some bumps and discoloration, and that's really more for fluid that's accumulated over a long period of time and usually without any sort of treatment going on. So the big question that a lot of people have is they notice some puffiness and they notice some difference in their tissues, especially with genetic situations. Is that just a different tissue or is it lymphedema? The early signs and symptoms of lymphedema are swelling, which kind of comes and goes or can stay. You feel like your skin gets tight or looks tight, and can even feel like it's tight and distended. Sometimes clothing, jewelry, socks, shoes, they start to get tight. Sometimes you feel numbness and tingling. It feels a little bit different in the area, or you get a pain and aching or a heaviness. So when those are occurring, you really need help to find out if it's lymphedema. Somebody that sees it frequently and can help you decide, is this lymphedema or is this something else going on at this point in time? So here are some pictures of lymphedema. There are just some examples. The ones in the center, you can see that the left leg has more lymphedema and the right leg is normal. You can see some of the puffiness in the hands and the toes and the tops of the feet. And it just looks like distended, kind of curvy tissue that's a little bit filled in. And those are all situations of lymphedema. So you think that you might have lymphedema, so now what do you do about it? And this is a really interesting topic and very important. There's a lot of people that don't know what to do if they have lymphedema, and there's a lot of physicians and healthcare professionals that don't know what to do if they see somebody with lymphedema. So the biggest and most important thing is that we find out whether anything else is going on medically, either to be causing the swelling or the edema, or that needs to be considered when dealing with or treating lymphedema or contributing to the lymphedema. When you go through the medical reasons, which we're going to go through, and you find out all the precautions that you need to take or possible causes, then it's important to get a lymphedema evaluation and treatment prescription and go see a lymphedema therapist. A lot of times, if the physician thinks that the person has lymphedema, they will count on a lymphedema therapist, myself included, to be the ones that really help determine that. They've determined that there's nothing that they want else to look at. They want my opinion and medical professional advice to help them decide if it's lymphedema. And often the lymphedema therapist will collaborate with the physician if they need further testing done or if they have any questions about the medical history, but they're often the ones that help diagnose the lymphedema. So the interesting thing is they used to say you have lymphedema, that's it. You have it, you need to just manage it on your own, and they didn't know where to send you. Now there's a lot of lymphedema therapists out there, and that they're showing that if you start to get these signs of lymphedema, of the tightness and of the swelling, and you go and get it treated right away, you might actually improve the efficiency of how the lymphatic system is working and maybe stop the lymphedema from progressing or worsening. So that's pretty exciting. So what medical professional should I contact first? I generally send people to whichever physician knows them best and is willing to work with them and me. Sometimes that's a primary care physician, sometimes it's a developmental pediatrician, and sometimes it's a specialist. Some people see a cardiac specialist or a nephrologist or a kidney specialist. They have problems with breathing. Any of those specialists that are going to be involved with circulation that you may already be involved with are good ones to talk with and either ask if they think that there's a reason that there's additional swelling, or to work with your lymphedema therapist to help determine if it's lymphedema and what you can do to help. You basically want their responsibility is to say there's no other contributing factors or nothing else medically that you need to consider during your treatment of lymphedema. If that is true, or they feel comfortable with having managed your other medical situations, then it's time to refer to a lymphedema therapist. So in North America specifically, I'm talking about, there's probably, I want to say probably about 8 courses right now of schools of lymphedema training. And when you complete 135 hours of training, you become a certified lymphedema therapist. Then in addition to the 135 hours of training, you can also take a examination from the Lymphedema Association of North America, And what they did was they tried to combine all the schools in North America and get professionals from all the schools to come together and make up one exam that could be taken by all the people that are specializing in it to make sure that everybody is comprehensive and saying the same thing. So then that would be an additional certification after you're a certified lymphedema therapist. Often, a lot of the schools will require that you're some sort of medical professional going in and taking the course, from being a physician, a physical therapist, an occupational therapist, a speech therapist, a nurse, a doctor. So frequently they require those credentials prior to completing some of their education and courses. With that being said, there are some minor courses or courses that are divided up into less hours at a time that can offer a lot of training in lymphedema therapy, Vater technique, or different types of pieces of the puzzle to the lymphedema problem. This is the most comprehensive. It means that you've completed the training that they consider the gold standard, at least in North America at this point in time. And it means that you've completed enough coursework to do all of the assessment and treatment. So how do you find a lymphedema therapist? There are, again, I'm speaking mostly about North America. There are also credentialing agencies and affiliations that we have with lymphedema associations across Europe and other parts and other countries. So if that's the situation and anybody's interested, I would be more than happy to help them find a lymphedema therapist in another country as well. So in North America, we basically want to see somebody that's a certified lymphedema therapist and has 135 hours of training. It does not have to be an occupational or a physical therapist. However, those are the ones in the United States that are paid for by insurance frequently. And they will cover the treatment under those categories. They may also have their LANA or their Lymphedema Association of North America training or completion. And if you are in the primary lymphedema from PMS, you want a person that understands the difference between primary lymphedema and secondary lymphedema and is comfortable working both with primary lymphedema and the age group of the child. When you're working with children that are still developing, the compression and the treatment that you're offering has to be adjusted so that it pays attention to a developing lymphatic system. Even if it has some damages to it, it still needs to allow the body to develop at the same point in time as treatment. And at the end of this, there's a couple pages on some of the websites and things that are out there for people to look through. So how is lymphedema diagnosed? Medical tests can give us some information. Often, most of the information comes from exclusion, like I said, other medical causes, and from observation, medical history, and interview. Most of the time, by looking and touching the tissue and going through medical history, a lot of information can be done just on that assessment. Medical testing that can be done, if you do any imaging like an MRI, CAT scan, or ultrasound, what you will see is fluid. So you do not know what the cause of the fluid is, but you will see the presence of fluid. You can do lymph vessel imaging. It is normally done just in a research situation because you're actually injecting dye into the lymphatic system, which a damaged lymphatic system tends to not want to disturb it by adding extra dye in. It's also a little bit uncomfortable. We look at volumetric measurements, different ways of measuring the areas that are swollen to see how much they're changing and retaining fluid. Electric conductance, how well the nerves and the tissue is conducting. Genetic testing, we are looking for markers in certain genetic conditions that show that just by having the genetic markers that you have lymphedema. Vascular imaging, if there's any problems with like blood clots or other reasons that might be causing swelling, or looking at how well the arterial and the venous circulation is working. X-rays are looking for blockages or positioning of different tissues in the body. Blood tests, they're looking for other causes of irregularities, and also one of the things they're researching to see if there can be a blood test that looks for lymphedema. Right now there is not. And bioimpedance, lymphedema is a very protein-rich fluid, and so they're looking at different ways of assessing the tissue to see how much protein is in the tissue. So what other causes of swelling must be ruled out? So it's very important that the fluid is not coming from some other cause, or that there's other causes that may be contributing but that are being considered during treatment and just to manage fluid. Your cardiac function, how well your heart is working and your circulation is working, how well the kidneys and the renal system is working, how well your pulmonary system and your lungs are working, if there is any blood clot or infection, any surgeries that might be contributing to swelling, any injuries, new or old, that can be contributing to swelling, any problems with the arterial or venous circulation, and any medications. So these are all things that can either exclusively be causing swelling or contributing to swelling, or must be considered during treatment of lymphedema to make sure that the body is removing the fluid and it's not just going to cause a problem somewhere else in the body. So how do you treat lymphedema? Currently, what I said at the beginning is we are treating and managing the swelling with the lymphatic system that we have. So at this point in time, the gold standard for treatment is to help get rid of the fluid as best we can and then keep it from coming back or congesting in an area. I will talk about some areas that they're hoping to work on, but right now we don't go in and repair the lymphatic system either surgically or any other way. What we're doing is we're working with the lymphatic system that we have and trying to remove fluid that is getting stuck in that region. So we decrease the swelling, we increase the drainage of the area that's getting congested, we soften the hardened tissue, we improve or enhance the person's function if they're limited because of the tissue problems, and we try and relieve any discomfort and improve quality of life. So that is the goals of a certified lymphedema therapist, and their treatment strategy is called complete decongestive therapy. That's what they're doing and working on with you. So manual lymphatic drainage is a decongestion technique using your hands. It's the people in the field don't like to call it massage, they call it lymphatic drainage, but it is basically using your hands to enhance the circulation and direct the fluid where you would like it to go through different techniques. The technique is very, very gentle. It is pushing on the skin. The fluid is accumulating just below the skin, so the pressure is not very deep. It's not the same even as a regular massage because you're not trying to get into the muscle layer. And this is done by the lymphatic therapist, and it's also trained for people so that they can do components of drainage on themselves or to if they're caregiving for somebody. They do, during the stage when we're trying to reduce fluid, we frequently use what's called short stretch bandages and layerings of bandaging and bandaging materials. These are not ACE bandages. They're the exact same color as an ACE bandage that you can buy at the pharmacy or at the store. An ACE bandage is an elastic bandage that when you pull it, it's got a ton of stretch to it. These bandages are called lymphedema bandages or short stretch bandages, and they're actually made out of 100% cotton. And the way that this system works through education and training of from the lymphatic therapist doing most of the work during this stage is by layering bandages. So the layering is applied to the areas of the tissue with most of the layers starting farthest away from the body and working its way up, and that's causing kind of a pressure gradient, directing the fluid from the extremities up towards the body where the fluid will be absorbed. And this is during and this isn't done all the time. This is during a decongestive stage when the therapist is trying to get rid of most of the fluid before it's being managed by the individual themselves or by the caregivers. Lymphatic exercise is basically making the muscles move in the area of congestion. It's the muscles and the tissue and everything moving helps the fluid to move. When it's sitting still, the fluid is sitting still. It really needs the activity of the muscles and the body in order to help push the fluid. Skincare, we look a lot at lotions and different things to help the skin be its best barrier to infection, the best ability to heal. Lotion also decreases chance of infection because it gets rid of the bacteria that sits on all of our skin. And then once the fluid is moved and the therapist has been working with people for a while, they really try and transition it so that most of the stuff can be done as frequently as possible by the person and their caregivers at home. So how to do some of the drainage on their own, and instead of bandaging, the goal is to go into some sort of compression to keep the fluid away. And I like to describe it, compression, as your vessels are like hoses, and you don't want the hose to bulge, and you don't want to kink it off. So you're trying to apply enough resistance and pressure on the outside of the hose that you're just preventing it from bulging. You're just giving it a little bit of resistance. And that's the goal of the compression garment, is once we've decongested the area, is to add just enough pressure to not let the tissue and the fluid fill back in again. Self-management with a pump or a pneumatic compression device. Pumps are, they were actually first introduced far before certified lymphedema therapists were involved, and they were introduced to help move fluid just by wearing the device, and they work by filling a sleeve with air that's worn over top and putting pressure from the extremity and pushing it up towards the trunk or towards the body. There is a lot of debate about pumps out there. There are millions of different kinds of pumps out there, and there's different pressures, different number of chambers, different ways of wearing them, different ways of turning them on and off. Pumps are loved by some, and there are some therapists that don't like them at all. The important thing is to realize is that there are many different kinds, and they have to be adjusted and taught on how to use them to assist your lymphatic system and to not be overcompressed and to cause damage to the lymphatic system. So that's the important part, to work with your therapist to make sure they're being used properly, and do realize that some people don't like them at all, but that they can be used very successfully as part of the treatment. And it's just that you just need to be taught properly on how to use the pump that you have, if that is something that you choose to do. So what else can I do? The area that is at risk, the area that might have lymphatic damage or not working efficiently, we want to try and decrease its stressors. We want to use it, we want to exercise it, we want to try and let it do everything that it's supposed to, but some things that we can do extra caution just to not stress the system are things in this list. We can avoid trauma or injury to that area, so we're not trying to increase any swelling in that area. Try not to do needle sticks or blood draws, again, only in the area that you believe to be at risk. You can use lotion. Try and do good skin and nail care. Try not to do cutting of cuticles or things that might introduce bacteria to the tissue. Use sunscreen and an insect repellent. Be careful with razors, again, because you can get nicks and cuts. Try and wear gloves when doing activities that could cause nicks or cuts or scratches, like gardening or outdoor activities. If a scratch does occur, just wash it with soap and water and try and put a little bit of an ointment on there. If you have lymphedema, leg lymphedema, would be really cautious with toenails, and you can even, a lot of people will even get a podiatrist to cut the toenails. If you see any signs of athlete's foot or like yellowing of the toenails and discoloration, you can get medication to make sure that it's not spreading, and you can also just use a preventative spray in your shoes or on your toenails. If you have any signs of infection, so the common type of infection that people with lymphedema get is called a cellulitis infection. A cellulitis infection, you normally get really, really hot, red, puffy very, very quickly. And sometimes people feel like they have flu-like symptoms and a fever. They don't always get a fever, but sometimes they do. And that's just a sign that the bacteria has gotten into that part of the body, and we really have to get it on an antibiotic right away. And it's something that can't be watched over a period of time for people who do get cellulitis infections. If they're not treated within a couple of hours of noticing it, people often end up in the hospital on IVs to get antibiotics to treatment, because it just spreads really, really rapidly. So the important thing is if you think you have an infection, just go and see if you need an antibiotic. And keep the body part moving. The more that you move the tissue and the muscles, the more that will help move the fluid. Those are all things that you can do no matter what. You can reduce the chance of your lymphedema worsening or developing by being active, by making sure there's nothing that's cutting off your circulation, like too tight of socks or clothing or too tight of shoes, and if appropriate, wearing compression garments as they're as they're suggested by your therapist. So fitness is important, again, being physically fit just to keep moving and to maintain a healthy weight. Weight control is important because the more weight you have, then you have a larger amount of tissue that needs managing, and the lymph vessels have to try and work harder to manage through all the tissue. They also, sometimes excess tissue can, the tissue itself can lean on the vessels and cause a little bit of inefficiency in the lymphatic vessels. So you can exercise, you can move the part through play, by swimming, or by somebody helping you move the body part back and forth. Swimming, walking, biking, rolling, crawling, carrying, any kind of movement, rhythmic movement is all great activity. So research currently going on, they are trying to develop a way of diagnosing lymphedema by a blood test. As of right now, that is not complete. They're looking for genetic markers. There are some out there, nothing specific to PMS at this point in time, but they're trying to look at signs, some markers that indicate lymphedema. They are trying out medications. I think one's being tried out in Australia, but there's nothing in North America at this point in time. So there's lots of areas that they're trying to do. Another thing they're trying to do is they're trying to do microscopic surgery, where they transfer lymph nodes from a healthy area to a different area and try and reconnect them to the lymph node system. All these things are being done in research, and none of them are standard practice at this point in time, but hopefully they'll continue to develop these areas to help actually repair the lymphatic system. So lymphedema can be managed. You can control it. But we can't repair the lymphatic system at this time. It has been seen both in my practice and elsewhere that if you really get the fluid under control, it is believed that your body becomes more efficient at managing it. That doesn't mean that it won't get stressed out at times and redevelop or worsen, but your body seems to, with repetitive treatment, actually become more efficient and possibly make new lymph connections, new vessel connections that help to remove this fluid. So it is a chronic condition because there's nothing that says if you do this today, then you're all done and you never have to do it again. But there is a lot that can be done to control it and keep it under control. So I added a new slide in. It says, what if it's not lymphedema, but I'm still swelling? This is through lots of conversation, both from Facebook and from different people that come in and see me. The principles that we use for treating lymphedema, we can often use to help manage different swellings. We can use the manual lymphatic drainage of directing the fluid and massaging and supporting the fluid. We can use bandaging and compression garments. We can use a lot of things to help push fluid that accumulates to different directions that we want it. The difference is just what else we have to consider. So if somebody is getting pooling of fluid in their legs when they're standing up, and it's not lymphedema, it's just, is it cardiac, is it pulmonary? Those are things that we definitely have to watch. Is there something going on in the heart or the lungs that we need to be supporting or considering when we're treating it? We can often use different types of wrapping and compression to support the legs and help manage the fluid. We can, if for some of us, our muscles don't work efficiently, or some of the people with PMS, their muscles aren't working the same way, there's different things that we can do to help encourage a muscle contraction or mobility of the tissue to help move the fluid. Sometimes I've used a tilt table with people in which it looks like a bed, but it's a table that you're lying on if you're trying to work on the circulation and how the body manages it, very, very slowly tilting the table from a lying position to a standing position and seeing how the cardiac system and the muscles and everything adapt to adjust to swelling. And then also people with vein and artery problems I'll sometimes work with, again, using some of the principles we use for lymphedema, but different medical considerations to work on. But still, we can still do things for people that are swelling, even if they're not having lymphedema problems. So some of the references is the National Lymphedema Network is a really, really good organization that talks about all the latest research, has blogs, has pages. They have some funding for people to buy garments, and they're a really good resource. The Dr. Stanley Roxon at Stanford University has a really excellent YouTube on lymphedema and emerging treatment. And then I've highlighted a couple of the pediatric websites, Pediatric Lymphedema, Lymphedema People in Children. They have some really good information on children because unfortunately children seems to be one of the areas of least amount of recognition or literature out there. It's gaining, but a lot of people do more work with cancer and trauma than they do in this area. And that is the end of my presentation.
Great. Thank you so much. That was wonderful. Thank you again. We do have a couple of questions. I do invite people to continue to submit questions if they have some. But Dana, if it's okay with you, let me see if I can organize them by topic a little bit.
Sure.
All right. So one I have is, I've seen my child's foot swelling. Is this considered lymphedema?
So foot swelling of unknown cause. It's very tricky to, if the swelling is intermittent, meaning it comes and goes, it's very tricky to see why we are swelling. Just by looking at swelling by itself without any other medical information, not necessarily. It could be anything from, banging your foot, which of course you probably notice, but it could be cardiac function. It could be how well your heart's working, how well your kidneys are working. If you have muscle inactivity and when you move around more, then you get the fluid moving around more. Just swelling all on its own is not necessarily lymphedema. It's more what else is going on in the body that needs to be looked at to see if it's lymphedema.
Great. So along with that, I'm kind of grouping these together. Can lymphedema spread? So my interpretation of that is if it's in one leg, could it spread to the other?
So true lymphedema cannot spread. What can happen is lymphedema only can occur in the areas where the lymphatic system is not working. So if we could clearly say that the lymph vessels in the right leg are affected but the left leg are not, then we would say that the right leg all the way from the belly button downwards could have symptoms and signs of lymphedema, but nowhere else in the body would you get that. However, often people who have primary lymphedema may have inefficient lymph vessels in different parts of their body. It is frequently seen worse in one part of the body than the other.
Okay, thank you. Next question is, if I've noticed swelling in the abdomen, how would I know if there was lymph there?
So if you've noticed just, again, so lymph can be deep in the body as well, but we normally notice lymphedema in the tissue. So the feeling of the lymphatic fluid is normally a little bit more like honey. It's a little thicker, and it's a little bit, sometimes you can see the tissue being a little more distended as opposed to, say, just a full abdomen with something going on in the stomach. It's actually the tissue and the changes in the skin and the thickness of the skin that would possibly show you signs of lymphedema in that area. You may need extra help from a lymphedema therapist, but that might be a way of telling.
Great. Next question is, can I just buy compression stockings and use them, or do I need to get a prescription?
So compression stockings are readily available at pharmacies. The trick is size and amount of compression. So in a person who is in surgery and gets those pretty white stockings put on them, they are put into an 8 to 15 millimeter of mercury stocking, and they're meant to resist pressures when you're lying down in bed. your circulation, when they take pressures of your circulation, in an adult with a healthy lymphatic system, if you are walking around, your pressures around your ankles are around 20 or so millimeters of mercury. When you're standing still, they go up to 30 to 40 millimeters of mercury of pressure. And so that's a healthy lymphatic system, what our pressures are. So when we are looking at how much pressure to put on somebody, when we're looking at an adult with a healthy system that had damage to it, we might be going up to 20 to 30 millimeters of mercury. When we're looking at a child, we put much less pressure, and we actually often don't use compression garments as the first form of treatment in children, because we're also then resisting the development of tissue a little bit too. So we're very cautious. The other thing is that the ones that you buy at the pharmacy come in size small, medium, and large. Sometimes they come in sizes 1 to 7 or things. When I measure somebody, especially in pediatrics, I take anywhere from 5 to 20 to 30 measurements to make adjustments on the proper fitting of their garments. And along those lines, there's a lot of different companies for pediatrics. They give discounts in garments and some free ones and some different variations of payments because they expect the pediatric population to go through a lot of garments just due to growth.
Thank you very much. That was the last question that I had on our list. So if there's nothing else, Dana, thank you so much again. For anyone who has further questions that come about later, feel free to email them to me at jackie@pmsf.org, and we will make sure that Dana gets those and can answer it. When you log off, there will also be a short survey to fill out, so you can share your experiences and any additional questions you have. And again, this will be posted on YouTube once we go through and edit out any of the intro. So thank you again, and we hope to see you on future webinars.
Thank you.